The recording will be posted on the committee's webpage after the meeting. For everyone's reference, today's agenda can be found under the first tab in the meeting materials. Welcome, committee members. It is now 10 a.m. on January 22nd, 2025, and I am calling the Nominating Committee meeting to order. I will start with an overview of the agenda, then we will do roll call, and then we will open the floor for public comment. After that, we will review nominations submitted for consideration, and then we will review the advisory committee charters. Let's do roll call. Do we have Carol Wilms here?
Yes, here.
Good morning, Carol.
Good morning.
Is Kim Wallace here?
Yes, good morning.
Good morning, Kim. And we did get a note from Ingrid that she was not going to be able to attend today's meeting. All right, so we are moving on to public comment. If there is anybody in the audience that wishes to provide public comment, please raise your hand. I don't think I see anyone, but if anyone comes into the meeting later, please let me know. Whoever would like to provide comments is also able to do it via email. All right. Committee members, we have 4 nominations to review today. If you go to tab 3, you can see we have the first one for the Stakeholder Advisory Committee. You'll be selecting one of 3 nominees from the Ambulatory Surgery Center Association. We have got first Catherine G. Root, then we have Jamie Fowler, and Devon Baker. I will just do a brief bio of each of the nominees. So Catherine, currently Vice President of Operations at Atlas Healthcare Partners, formerly Nursing Supervisor at Children's Hospital and Regional Medical Center in Seattle, holds a Registered Nurse Certificate and the hca Certified Administrator Surgery Center credential. Catherine has extensive clinical and administrative experience structuring and integrating departments, developing and directing programs, and leading enterprise-wide quality improvement. Catherine also has a proven track record of strategically designing and project managing construction of medical facilities, including interfacing with regulatory agencies, strong leadership and interpersonal communication among internal and external stakeholders to achieve company mission goals through collaboration and consensus building. That is the brief biography of Catherine. Then we will go now on to Jamie Fowler, currently Director of Operations at hca Health, Washington and Oregon Region, formerly Billing Office Manager at Pacific Surgery Center in Postville, Washington, holds a Master in Healthcare Administration from the University of Washington. Jamie Fowler's experience: professional with over 22 years of ambulatory surgery center experience and over 12 years of management and leadership experience, has led centers with all components of the quadruple aim at the forefront to include efforts around improving population health, improving patient experiences, reducing costs, and improving the well-being of team and providers. engages daily with stakeholders to drive continued success for Washington centers and access for communities. From 2021 to now, works on merger and acquisition, coordinated due diligence, negotiations, and final integration of ASC through acquisition by hca Health. And then from 2020 to 2022, construction project manager for extensive remodel projects and to expand square footage, addition of operating room and PACU spaces. That is Jamie. And then we have Devon Baker, currently Executive Director at Pro-Alliance Orthopedic Association, Pro-Alliance Surgeons in Renton and Seattle, Washington, formerly a clinical supervisor, holds a Master of Business Administration in Healthcare Management from Western Governors University, and a Bachelor of Science with emphasis on kinesiology from Washington State University. Areas of expertise include streamlined operations, leadership training and development, high engagement culture, budget management, and marketing and community outreach, among many others. Devon's experience includes being an innovative and forward-thinking executive with a proven track record in driving process optimization and spearheading long-term strategic initiatives that consistently deliver impactful results. Recognized for exceptional thought leadership and expertise in generating innovative, non-traditional revenue streams and leading technology integration projects that significantly enhance operational efficiency and elevate the customer experience. Experience in cultivating a high engagement culture and top-performing teams built on a strong foundation of influential leadership training and development programs that facilitate swift onboarding and foster resiliency during challenging circumstances. Committed to delivering continuous improvement opportunities with an unwavering dedication to excellence and an exceptional ability to excel in dynamic and challenging environments. Expertise in bundle payments, cost transparency, and cost estimate for patients. Would someone like to make a motion to recommend one of the three nominees as a stakeholder advisory committee member to the cost board?
So I would like to, if possible, could you review the stakeholder advisory committee charge, and do we have a list of sort of all the positions or representatives that exist on the committee currently? I mean, I know this is the ASC representative, but I'm wanting to just reflect for a moment on the makeup of the committee, and I'm imagining the group, coming together, and I'm just wanting to be thoughtful about the type of particular perspective and expertise that the new member would add from the ASC perspective.
Yeah, really appreciate that idea, Kim. I think that's really thoughtful, and it's going to take us just a minute to get that pulled up. Would it be okay if maybe while I pull that up and get us prepped to talk about that, we talk about the potential data advisory committee member, and then come back to the stakeholder in just a couple minutes?
Oh, sure. That's fine with me.
Sounds good.
Okay, great.
Okay. All right, we will get back to that. Let us go to the Data Issues Advisory Committee slide. We have one nominee for the Data Issues Advisory Committee, Dr. Nobuchi Anipesi. He is the Senior Director of Health Systems and Workforce Intelligence within the Executive Office of Healthcare Innovation and Strategy at the Washington State Department of Health. Dr. Anipesi holds a Dr. PH in Health Services Research from UT Health Science Center at Houston, an MPH in Public Health Administration and Policy from the University of Minnesota, and a medical degree from the University of Ibadan. The experience is in major academic health centers, federally qualified health centers, and the pharmaceutical industry. 10+ years using large volumes of real-world data to improve population health, healthcare access and equity, leads management and state health workforce data to provide insights and inform policy decisions, especially related to cost management, Medicaid populations, and underserved communities. Would someone like to make a motion to recommend Dr. Nobuchi as a Data Issues Advisory Committee member to the Cost Board? Carol?
The experience stated and credentials seem really appropriate for this committee, and I would so move. Is just for clarification, is this a recommendation from the nominating committee to the board to consider?
Correct.
Then that is my motion, that we recommend Dr. Nobuchi to the board for approval for the data committee.
Is there a second?
A second?
All in favor say aye.
Aye.
Any opposition? Thank you. Approved by consensus, and we will be bringing this decision for the review at the next Cost Board meeting.
Okay, great. And I am just logging in real quick to the Zoom and then can share the current roster of stakeholder committee members. And yeah, Kim.
Oh, I'm sorry, I'm not hearing anyone speaking.
One second.
We have a bit of an echo, so we're making sure we.
Okay, can you hear me okay? Thank you so much for your patience with us. We're in a different room than usual, and our usual ops champion went out on maternity leave just last week. So we're doing our best. Thank you so much for your patience. Okay, all right, I am logged in. Let me just see if I can share my screen, and it doesn't look like, Audrey, do you need to give me permission to share?
Let me see. Okay, it looks like, let me promote you to a panelist.
Perfect, thank you. Okay, great. Can you see the screen okay? All right, so this is the current membership. It does cross over a couple of pages, so let me know when you're ready for me to scroll. And I'll note there are a couple other names in here that are due to be updated as well, and we're working with the representatives of those seats to get some new nominations, and I think we will bring that forward in March for your review.
Okay, I'm ready for scrolling. Are you, Carol?
Perfect.
Question as well. Are staff familiar with any of the three candidates?
We do not know the three candidates.
Mm-hmm. And Kim, I'm assuming based on your questions that you are not familiar with any of the three candidates as well?
Correct.
Yeah, and I am the same. So we are going upon
Yeah.
the paper qualifications, which they all seem compelling and similar. This is a very difficult choice.
Agreed. I don't envy your position. Would it help, do you want us to pull up the bios again? They're in front of you.
And I've got all of them in front of me as well, but sure, that might help. I'm sorry, Kim, were you done looking yet, or did you still need to look at the roster?
No, I feel similar to, thank you for your comment, because I do feel I'm having the same thoughts. Because clearly they're all I think have very impressive relevant backgrounds, right? And presumably expertise. And this is a stakeholder advisory committee, so I'm trying to ground my thinking in it's not really sort of evaluating each of them in terms of their fitness or their, um, you know, sort of acumen or anything like that. It's not really evaluating them as individuals against one another. I guess I feel like what I'm trying to think through is the contribution, the perspective that they each of them would likely bring to enable better consideration and thinking by the committee. So that's why I asked. Thank you very much for the to refresh my mind about the current membership. So I do think it's not so much about evaluating each individual. It is about trying to foster and create a really solid, helpful committee overall. And so, what perspective would likely, you know, be represented in a way that would really help the committee and the board. So that's the process that I'm going through in my mind. So can we look at each one, the information again?
So we have Catherine, currently Vice President of Operations at Atlas Healthcare Partners, formerly Nursing Supervisor at Children's Hospital and Regional Medical Center in Seattle, holds a registered nurse certificate and the CASC, or the Certified Administrator Surgery Center credential, extensive clinical experience and administrative experience structuring and integrating departments, developing and directing
Oh,
programs.
I'm sorry, could you advance the slide? Oh, thank you.
And leading enterprise-wide quality improvement. Catherine has proven track record of strategically designing and project managing construction of medical facilities, including interfacing with regulatory agencies regarding compliance with federal and state laws. Catherine has strong leadership and interpersonal communication among internal and external stakeholders to achieve company mission goals through collaboration and consensus building. And then we have Jamie Fowler, currently the Director of Operations at hca Health Washington and Oregon regions, formerly Billing Office Manager at Pacific Surgery Center in Postville, Washington, holds a Master's in Healthcare Administration from the University of Washington.
Actually, before you read through that one, we'll let you read through this slide. And I also just want to note that in the packet that we sent yesterday, we also, Josefina also included the resumes of these folks just to give you kind of a rounder picture as well.
Yeah, I would just take a moment to say that, again, they all three have very compelling qualifications. Clearly, all three come recommended from the association. There was wording in Jamie Fowler's experience and CV that resonated with me with the goals of this particular stakeholder committee, particularly around improving patient experience, reducing costs of, improving health population, and transparency. There was healthcare cost transparency. There was a mention of that as well. Those were some words that just kind of leapt up compared to the other two, but again, really, it's just marginal. And Kim, maybe there was something that leapt up in your mind of one of the three.
Well, I do find myself pondering again regarding Jamie Fowler, the M&A experience. I think that that we know that that activity in healthcare is of keen interest and is really it's a very important feature, very impactful feature of what is happening in the healthcare system writ large. And in terms of the mission of the board, we've identified that the financial transactions, and governance transactions that have happened or are happening frequently, in healthcare, what drives those, the impacts of those, the realities of those changes and those transactions is, that's really clearly a very prominent sort of driver of the the situation that we're in, and we need to understand. I think it's good. It behooves us to understand the that those that activity, and the drivers, and the results, and impacts of that kind of activity. So that did jump out to me, that on Jamie Fowler's information as well, in addition to what you said about Carol, about in the second bullet there, and in Jamie's experience. Can we look then at Devon again as well? Okay, and the next slide. So, Carol, one of the things I'm thinking of, if we go back to Jamie Fowler again, so Carol, one of the thoughts I find myself having is that there is a slight, it feels like there's a slight difference in the focus of the highlighted expertise and experience, and that difference that I'm wondering about is a focus that is organizational leadership, and operational leadership, which we all know is difficult and really is what makes makes the healthcare system work, is people who can really make sure that the entities in the healthcare system are performing well. And so I'm not discounting that expertise, in any way. I am noticing that there is emphasis in Jamie's background here that is focused up and out, focused on the mention of the quadruple aim and population health, and reducing costs and engaging with stakeholders, regularly engaging with stakeholders, that is looking up and out, and wanting to affect change, that sort of improves the system and conditions broadly, and that is what we're after, of course, in trying to do really good public policy development and implementation. So again, not to discount the excellence that is articulated and represented with the others, but I think I'm noticing that there's some special emphasis on system-wide opportunities and improvement efforts that I'm drawn to.
If,
Do you have any thoughts about that, Carol, or,
yeah,
questions?
no, those are good thoughts. And I like that perspective of kind of an overarching or more industry impact, versus kind of internal projects success. And I'll just put forward a motion and see where we go, to put forward the nomination of Jamie Fowler to the Healthcare Cost Transparency Board as a stakeholder committee member.
I'll second that.
All in favor, say aye.
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 Any opposition? Thank you. Approved by consensus. We will bring forward Jamie Fowler for review at the next cost board meeting.
Wonderful. Thank you. I have a follow-up question for you. Just in memory of, one of the first meetings that we had, might have been last meeting. Is there a component of a nomination that has an expression from the candidate of why they personally wish to serve on the committee? Is that a part of the application process? Can you remind me?
It's not a formal part of the application process, but I think I'm hearing that there is some opportunity for improvement there, that would be really helpful to our nominating committee members, just to hear from the candidates in their own words about their interest in serving and, how they want to bring their experience to the opportunity. So I think we can start to ask for that kind of a letter of interest of sorts, or maybe not even a letter, just even a paragraph of interest.
Yeah. I think that just would have been just that much more helpful to Kim and I, and I'm certain Ingrid, if she had been here, and not being familiar with any of the candidates, it just might be an added element that would be helpful. So thank you.
Appreciate that. Yeah, really appreciate that feedback, Carol. I think we will implement that going forward. All right, go ahead.
Thank you both, and we are now transitioning to the next item, which is under tab 4, reviewing the advisory committee charters. Currently, as it stands, there is no enforcement on attendance written into the charters, and there was review of attendance for last year. Therefore, we're bringing this to your review and consideration. The charters have been updated to indicate if you miss 3 or more meetings per year, you will be removed and replaced from depending on what committee we are talking about, as regular attendance is essential. The exact wording you can find under tab 4. You can look at the Advisory Committee of Healthcare Stakeholders, which is the first one. If we scroll all the way to the end, it's in red, the area that has been added. I'll give you a little bit of time to look at it if you have not had time yet.
So question on clarification of process is this is rolled, if adopted by this committee, to then be adopted by the board. Again, same process, right? And then once adopted by the board, then rolled out to the respective committee members as from here forward, this is an expectation. So the track record starts from that moment forward.
That's correct.
Yeah, okay, great. Would you like us to take these as one motion for all advisory committee member charters or our advisory committee charters, or to take each charter as its own?
I think if you are comfortable with the language of making a motion and approving for both charters is acceptable.
Yeah.
Kim, you're on
So
mute.
I have a
There you go.
question for, so can you remind me, just for kind of thoroughness sake, if there is a similar formal expectation, including enforcement, with respect to the board?
Great question. I believe that there is. We can pull up the board charter and double check that. It's, you know, the board, there's a little bit of a different approach since
Yes.
the governor appoints those members.
Yes.
And so, you know, the level of participation and engagement is just a little different in our experience there.
Right. No, and that's exactly what I was thinking, that it's a little bit apples and oranges, and I acknowledge that. But I also think that, you know, we're talking about the integrity of the process. And so I just wanted to note that the sort of formalities, the difference in the formalities notwithstanding, the integrity of and consistency of the participation and engagement is at the heart of, I think why we're entertaining this this attendance requirement. And so I do think that it makes sense to note that attendance and engagement at the board level is really important as well. That's, I guess, my point. I'm just making that point officially, I guess, in this forum. So thank you. I don't need to know right now if there's an official requirement, but so thank you for the opportunity to just share my belief and my personal commitment, to the work of the board.
Yeah, we really appreciate your raising that, Kim, and I think that's a good reminder for us that next week at our board meeting, we're actually hoping one of you might be willing to just give an update to the board members about the discussion today, to bring forward the recommendations for the charter and the 2 new committee members. And we on the staff team will also put in that reminder about attendance for the board and the board's charter in that too, just as Kim, you raised. That's a good opportunity for all of us to refresh ourselves. So thanks for the suggestion.
One thing I think is, important about boards, I'm sure, Kim, you serve on many others. I know I do as well, and have boards of my own that I administer. Sometimes the difference between a board and a committee, a board is excused absences. Board members oftentimes serve on many boards.
Yes.
I work with many elected officials, with the Association of Washington Cities. So excused absences are distinguished from unexcused absences on a board. A committee is oftentimes, sometimes more of the layman's expertise, and the participation and absenteeism in particular from those conversations is really key to the recommendations to the board. So just wanted to maybe offer that distinguishing factor
Good
between
point.
a committee and a board, and also the governor appointment as
Yes.
well is probably a distinguishing factor on a board. If you need a motion particularly on the change to the charter, Kim, I'd love to leave that to you and be your second this go round.
Well, I do have, and I can do that and then ask a question or ask a question right now,
Oh, I did
which
not
is
want to rush you. Go ahead.
Well, so my question is, I noticed that we've mentioned 3 or more meetings in a calendar year. And so I just want to make sure I understand the meaningfulness. I mean, I understand that it's important to kind of time bound. We need some kind of reference point to be able to um, uh, count, absences and then kind of understand the impact of those and the frequency and so I totally understand why we would say per calendar year. I guess what comes to mind is, as written, um, a person could miss two at the end of one calendar year and then miss the next two at the beginning of the next calendar year for a total of 4 in a row. um, but still not hit this. And maybe I'm putting too fine a point on it and you know, getting kind of overly concerned about this detail. But I just was wondering if that that kind of feature of sort of counting the absences was considered and if we feel like um, it's just the best way to go about it and just make it per calendar year for for sort of administer this. It's a reasonable measure. It sends the message that, hey, your expertise is needed, and so we really lose out, if you're not participating. So I can support it as written, but I just wanted to ask first about this funny dynamic that could come into play by anchoring this to the calendar year.
Yeah, such a good question. I think we were primarily thinking about just the ease of tracking, and you're right, just need some denominator to put
Yeah.
forward in this. What we could do is add another clause in here that tries to get at that, saying 3 or more meetings in a calendar year, or 3 or more consecutive meetings, to try to get at that, crossover between November to February kind of thing. So that would be another option to try to get around that.
Yeah, I don't know. Thank you for that. I don't want to overcomplicate it. I'm wondering if the 3 consecutive, does that get to the same issue? I guess because I don't want to introduce extra detail that doesn't really add value. Um, if in fact consecutive meetings, tail end of one year, first of the next year, if that actually is the same concern, it gets at the same concern, then, and there's an equivalency, then I I think that could be added because it's quite clear what it means. It doesn't create a awkward mystery about what the expectation is. Carol, do you have a reaction or thought about that?
Good to follow your lead. If you would like to add um, to the starting quote of if you miss 3 or more meetings per year, or 3 consecutive meetings in a 12-month period, you will be removed from the blank advisory committee.
And do we need the or more? Do we think, or does that really add? Is that not the point? Is the 3 the point?
Yeah, I think that's perfect. That addition is good, and I would be supportive of it.
And in the beginning of the sentence, if a committee member misses 3 or more in a calendar year, do we need the or more, or is that kind of redundant?
Yeah.
I think we mean 3.
Yep.
So I would move that we recommend this additional language regarding attendance for advisory committee meetings to the board.
I'll second
Is there a
that.
second? All in favor say aye.
Aye.
Hi.
Any opposed? Thank you both. Approved by consensus, and this will be brought for review and final approval at the next cost board meeting. Thank you both. That brings us to the end of today's meeting. We will bring these nominations and charters to the next cost board meeting on January 30th for final review. Thank you, Carol and Kim, for your time and participation in today's meeting. The recording and summary of this meeting will be posted shortly on our website.
And actually, before we let you go, Carol or Kim, would one of you mind volunteering to bring a summary back to the board at next week's meeting? We'll have a couple of guiding slides for you to talk through that we can share in advance, but would one of you be willing?
Sure. I'd be happy to.
Really appreciate it, Carol.
Thank you, Carol.
So much.
You're welcome.
We'll make it easy on you.
Oh, I know that you will. What would we be without staff? Committee or board
Appreciate
members. Yeah, thank you so much. And it's good to see you.
Thank you. Thank you.
Yeah, thank you. Have a wonderful week.
Yep, you
as
too. Bye.
well. Bye. Bye.